Good afternoon, everybody. This is Dr. Keshav Sadhwani. About myself, I have been practicing nephrology, the specialty of kidney disease, in this part of NCR for last about 3 decades. As a qualified nephrologist, I have to treat my kidney patients. And in kidney patients, there is a stage which is called end-stage kidney disease, ESRD, where in one way or the other, we have to replace the lost kidney functions by artificial means. And this artificial mean is called dialysis. Means filtering out the accumulated toxins and the extra fluid into the body in a kidney patient to make him comfortable and to make it less risky life. And this process of dialysis broadly is of 2 types. One is hemodialysis. As the name implies, the filtering of blood means we take out the blood from the patient, filter it through a filter by a dialysis machine, and filtered blood is sent back to the patient. This is called hemodialysis. Second mode, which is done at home by patients, which is called peritoneal dialysis. Putting a catheter into the peritoneal cavity of the patient and training the patient to do dialysis at home without dialysis machine. So today we'll be discussing about various types and methods of hemodialysis. Means dialysis by filtering the blood of the patient, which is having an accumulated toxin and the extra fluid. So hemodialysis is normally done in a center, means dialysis center, dialysis units. Every good hospital has got a dialysis unit where we call the patient and put the patient on hemodialysis procedure of about 4 to 5 hours duration, and where we make the patient lie down on a bed and cannulate to take out the blood and percolate this blood through an artificial circuit of the hemodialysis filter, hemodialysis tubings, and with the help of dialysis machine, which is monitoring the procedure and sending back this filtered blood to the patient. Now, in-center hemodialysis, this is called in-center hemodialysis, which is the most common modality of hemodialysis, which is offered to a patient of end-stage kidney disease. Now, in-center hemodialysis is basically done by trained and qualified technical staff in a trained dialysis center, in a good hospital setup, with all monitoring facilities. So this is the safest and the risk-free method of giving an extracorporeal treatment to the patient of kidney patient. Now, some modifications of this procedure are about the place and the mode of dialysis. If we institute the same hemodialysis session by the same dialysis machine, by same dialysis circuit, but done at the home by the patient and patient's aid, which has been trained into a dialysis center, that is called home hemodialysis, means dialysis done at home. Now, if we are doing dialysis at center, it is mostly done 2 to 3 times per week, sometimes daily in a critical patient. And if we do dialysis at home by training the staff of the patient, by training the attendant of the patient, by training the patient in a center for 4 to 6 weeks, and when we feel comfortable that this particular staff of the patient and this particular attendant or this particular patient can perform the procedure nicely and safely at home, then we shift this dialysis setup to his home, where he can do dialysis at home. Now, this dialysis at home can be done 2 to 3 times in a week, as it is done in the center, or it can be done at the daily basis. So amount and quantum of dialysis varies by the 2 factors. One, patient's need, and second, doctor's prescription about a particular patient. Now, third modification of this dialysis is dialysis at home, but daily dialysis at home, or maybe an intermittent dialysis at home, doing 2-3 times in a week or doing daily. And lastly, is called nocturnal dialysis. Means patient is getting dialysis during daytime and wasting his productive time. So if we offer the patient a procedure, the same procedure of different duration, maybe whole night, maybe 8 hours, maybe 10 hours, maybe 12 hours, but done at the night, the productive part of the day of the patient can be utilized by the patient's profession. So this is called dialysis at night, maybe at center, maybe at home. It's called nocturnal hemodialysis. Now, nocturnal hemodialysis by itself is a dialysis done maybe at center, maybe at home for a longer period of time, maybe 10 hours or 12 hours. Obviously, this dialysis dose is quite high for a patient, so that patient is relatively very better cleared of the toxins and the excessive fluid accumulated into the body, and the quality of life is much better in this type of nocturnal lengthy hemodialysis. Then we perform a procedure which is called SLED, slow low efficiency dialysis. Now, this particular dialysis is needed for a patient who is hemodynamically unstable, like his blood pressure is not fine, his heart condition is not fine, he's getting dialysis at center and he's getting some troublesome side effects during the dialysis. Then we modify this dialysis procedure at center in a form of called SLED, slow low efficiency dialysis. Saying all this is all about doing dialysis at center or doing dialysis at home, maybe doing for 4 hours, maybe doing for 12 hours, and doing daily or doing alternate day, doing twice or thrice in a week. This all depends on the particular specific requirement of a patient's internal atmosphere, and by a doctor's assessment and doctor's prescription. So this is all about the hemodialysis procedure. Hemodialysis is replacement of kidney functions. It is said this is a kind of renal replacement therapy. It is a therapy given to a patient when kidneys are at the end stage. When kidneys are impaired more than 90% of its capacity, then the patient needs some replacement of kidney functions in form of hemodialysis or peritoneal dialysis. But this dialysis, being an artificial process, is not a complete replacement of kidney functions. It is just to remove the extra accumulated toxins, extra accumulated poisons into the body, and extra accumulated fluids. Kidney, being a versatile organ, it performs the basic need of the body to get rid of this excessive toxins, to get rid of excessive water. But besides these two important functions, the native kidneys perform so many other endocrine and hormonal functions which dialysis cannot replace. So obviously, the patient needs regular assessment and the monitoring and investigations by a qualified nephrologist to perform the dialysis procedure to supplement these remaining functions of the kidney. Thank you.